tuwapigie makofi. Asante sana, asante sana. Thank you very much watoto wetu. Tuwapigie makofi vizuri. Thank you very much. Naona anasakata luba vizuri. Sasa ni vizuri tuendelee bado na entertainment. Na kwa sasa kabla tuendelee ningewaomba wale wako na namba 110 to 140 tuendelee pale. 110 to 140 tuende tu vizuri tupage line pale tunapoendelea na kutubuizwa. Kwa sasa tuko na kijana mmoja balubalu kutoka Lions Club from Zite College. Angependa kutupatia wimbo moja. Karibu sana Bwana Victor.
Mine is a motivational song. To the cancer patients, probably you might be struggling na bills za medical, but nikiimba hii God atatusaidia.
Imekuwa na changamoto nyingi, kujiamini juu shida ziko nyingi. Sometimes unakosa hata shilingi, but we survive thanks God is still living. Life imekuwa na changamoto nyingi, kujiamini juu shida ziko nyingi. Sometimes unakosa hata shilingi, but we survive thanks God is still living. Tulia, hizi shida ni kwa muda, kama tu bahari zina flow zikipita. Pete na unaringa basi kwenda kabisa, kiwa na shida unanitoka but I know kuna Jesus. Wale kiyomoka mtani follow kwa kina, but tumewasi mind na wakaribisha. And I know watatalk, wase watatalk, majirani watatalk na mabeshte watatalk. Bad life yangu bado wezi stop. And I know watatalk, wase watatalk, majirani watatalk na mabeshte watatalk. Bad life yangu bado wezi stop. Life imekuwa na changamoto nyingi, ujiamini juu shida ziko nyingi. Sometimes unakosa hata shilingi, but we survive thanks God is still living. Life imekuwa na changamoto nyingi, ujiamini juu shida ziko nyingi. Sometimes unakosa hata shilingi, but we survive thanks God is still living. Pia pressure imetumaga vijana tena sana. Big lives tunalive kwa streets, and that's true. But things work out best for those who make the best of how things work out. Maisha matamu tulia, achana raha dunia. Siunganishe na mwenzako maisha yako. Just live your life. Na ya kesho usijisumbue, cause ya leo bado ya kusubiria. Na ya kesho usijisumbue, cause ya leo bado ya kusubiria. Life imekuwa na changamoto nyingi, ujiamini juu shida ziko nyingi. Sometimes unakosa hata shilingi, but we survive thanks God is still living. Life imekuwa na changamoto nyingi, ujiamini juu shida ziko mingi. Sometimes unakosa hata shilingi, but we survive thanks God is still living.
God bless you.
Tumpigie makofi vizuri sana huyu kijana mdogo hivi kutoka pale Zite College. Kwa sasa ningependa tupromoshewe wimbo mbili tu kidogo na badi yetu kutoka Prisons Band. So karibuni sana Prisons. In the meantime, tunaendelea bado na screening. Tutawaelezea hiyo namba nyingine tutawaita. So Prisons. Wow, tuwapigie makofi badi yetu kutoka Prisons Band, na tunaendelea tu vizuri na bado tunaendelea na kutubuiza mpaka saa zile tutaweza kuanza pia na speeches zetu. Wageni waheshimiwa, kwa sasa kabla tuendelee, nikipenda kuita namba 130 to 160, 130 mpaka 160, tuende pale kwa registration. Kama uko hapa namba 130 to 160, tafadhali twende pale tukaweze kufanyiwa tufanye registration. Kwa sasa ningependa kumuita one of our survivors. Today is World Cancer Day. Now World Cancer Day is usually celebrated marked tarehe 4 February kila mwaka, tarehe 4 February, na kwa leo niko na mgeni mmoja ama one of our survivors ambao amesurvive mambo ya cancer au ugonjwa wa cancer, anaitwa Robert Mwangi, ambaye tuko naye hapa. Angependa kuongelesha kidogo kwa dakika 2 tu ili tuweze kuendelea na ratiba yetu. Bwana Robert.
Amjamboni, wageni waheshimiwa na wananchi wenzangu. Kama vile mmesikia, jina yangu ni Robert Mwangi na mimi ni throat cancer survivor. I am an addiction counselor, na kansa yangu ililetwa na utumizi wa sigara. Kwa hivyo ningeomba vijana wale ambao bado hawajaingilia hiyo tabia ama wale wako ndani ya hiyo tabia, tafadhali naomba muachane nazo kabisa, sababu singetaka mpitie ile uchungu niliyopitia wakati wa matibabu. I will be celebrating 20 years of survival. Mwezi wa 3 ndio niligonjeka 2003 na nina celebrate kanisa hali ninaenda tarehe 12 mwezi wa 3, ndio watu wajue cancer is not a death sentence. Mimi ni mshauri wa wale ambao wanapitia mambo ya uraibu wa mambo ya drugs, mambo ya tobacco na pia mambo ya cancer, kwa sababu kazi yangu ni kumotivate wale wanapitia mambo haya magumu ya cancer, wajue wataishi kama mimi. Nimemaliza miaka 20 na ninangoja kumaliza ingine 30. Kwa hivyo tutasurvive na tutaendelea na kazi zetu kama kawaida. Mimi pia kuencourage watu, nimeweza kuandika kitabu kinaitwa Double Loss, ambacho kimesaidia wengi kuwa encouraged na kujua kwamba watatoboa safari ya kansa. Mimi ningeomba wale ambao tunasurvive tuendelee kuwa motivators wa wale ambao wanapitia janga hili la kansa. Nimeambiwa nitumie dakika 1 tu, na hiyo ilikuwa tu ya kujintroduce, lakini bado niko na nyinyi mpaka tumalize. Kwa hivyo ukitaka kujua mambo zaidi, unaweza niongeleza nikueleze zaidi vile nimetoboa miaka 20. Asanteni sana.
Mungu akubariki, tupigie makofi. Asante sana, asante sana. Ni vizuri tujue kwamba ugonjwa wa kansa watu wanapona, sivyo? Na unaendelea tu akihili pole pole mpaka dakika ya mwisho. Kwa hivyo sasa tunaendelea tu bado na kusikia testimonies kidogo. Wa pili, kabla bado tunaendelea, wageni waheshimiwa, ningependa kumwalika Madam Lucy Lucy has been ama amekuwa pia mwadhiriwa wa ugonjwa wa kansa, na pia yako na dakika moja ama mbili kuongea kabla tuende na session yetu. Karibu sana Lucy.
Wageni waheshimiwa, nashukuru sana kwa hii muda na nafasi. Mimi pia ni mwadhiriwa wa saratani ya matiti. Kwa hivyo ninaposimama mbele yenu, mimi ni wa matiti moja na huwa naringa na hiyo moja. Sababu hakuna haja nipate mbili na nikue kwa kaburi. Heli nikue na moja na niko uhai. Hiyo ni kulingana na mimi. Nilipatikana na hii saratani ya matiti 2017. Nilipokuwa nimemaliza kunyonyesha mtoto wangu. Nikaenda hospitali pale Kenyatta, wakanikata matiti, wakanipea chemotherapy, wakanipea radiotherapy. Hii nywele mnaona hapa ni urejesho. Huwa nasema kuna urejesho ya namna mingi, na nywele inangukanga kila mahali mpaka huku kwenye uko na nywele. Nataka kusema matibabu hapa Kenya inafanya kazi. Watu we embrace what we have. Pengine hatujafika mahali ambapo tunatarajia tutafika, lakini Kenya tuko nayo, at least to embrace. Manake mimi nimetibiwa hapa Kenyatta na nimesimama hapa mbele yenu. Kitu ningependa kuambia watu, ugonjwa ya kansa sio homa. Ugonjwa ya kansa inaathiri mawazo na familia na ndoa. Wazee wanakimbia, lakini mzee wangu hakukimbia. At least alisimama na mimi. Inaathiri mawazo yako, sababu huwezi fikiria venye watu wengine wanafikiria. Ulikuwa na future yako na mipango yako, lakini unakuta imeathirika. Na sisi kama society tuna practice kitu inaitwa toxic positivity. Utapona, uko sawa katika jina la Yesu. Ukigonjeka kansa inapatikana hospitali, nenda katibiwe hospitali. Hakuna wakati kansa itapatikana na mzee wa kijiji. Kwa hivyo tunapoteza. Hakuna wakati utaenda kanisani padri ama pasta apate kansa. Lazima uende hospitali ufanyiwe investigation iende kapatikane. Hakuna wakati. Kwanza sisi tunaamini Mungu sisi wote, lakini mapadri zetu, wahubiri wetu wanaenda wapi? Advanced treatment huko outside the nation, si ndio? Lakini sisi tunaenda altar call. Yeye anapanda ndege anaenda kupata matibabu huko, na sisi tunabaki hapa na altar call. Tunaenda kusema tuwekelewe Kataloni katika jina la Yesu. Katika Yesu ni mzuri, lakini pia imani inasema ufanye jambo, si ndio? Faith without action is, nasemanga sana.
Wow. Tupigie Lucy makofi. Thank you. Lucy has been my student for long. At least ameenda kiendelea vizuri, na bado unaona kwa mzima na kwa mzuri. Being a cancer survivor, amefanya kazi mingi kwa the community, na thank you very much Lucy for what you are doing. Sababu kansa bado unajua iko na process kubwa kabla pia mtu apone na endelee bado kupata matibabu. Kwa sasa tuko na insurance ya serikali ambayo inatusaidia sana sana kuweza kupata matibabu ya kansa. Kwa sasa ningemwalika yule amesimamia NHIF, tuko naye hapa, aweze kusema machache kuhusu NHIF. Labda hata hapa unaweza pia fanya registration yako hapa, na pia unaweza pia pata kadi yako. So karibu sana Nick, na tunapoendelea number 170 tuende mpaka 200, tuende pale kwa registration. Asante.
Thank you. Hamjambo nyote. Kwa majina naitwa Nick Tsuma kutoka NHIF Ruaraka. Tuko hapa katika hii mkutano wa kansa, na NHIF inasimamia matibabu ya kansa. Tunasimamia chemotherapy, radiotherapy, PET scan pia tunasimamia, na CT scan ya planning pia inasimamiwa katika matibabu ya kansa. Na serikali inaendelea kuangalia mikakati zaidi ya kusaidia wagonjwa wa kansa, na tunaomba wale wajajiandikisha wajiandikishe ndio waweze kupata hii matibabu. So kuna matibabu zaidi itaongezwa katika hiyo benefit package kusaidia wa Kenya katika mambo ya kansa. Hata breast cancer pia tulishirikiana na wenye wanatoa dawa fulani hapo kupunguza hiyo gharama ya breast cancer also. So NHIF inasaidia katika cancer treatment. So ujiandikishe. Tuko hapa leo katika huduma tent. Unaweza pitia hapo kwa registration au kufanya biometrics. These days we don't do the cards. Unafanya ile biometric na kidole. So mnakaribishwa kwa hiyo tent ya NHIF. Asanteni.
Tumpigie makofi brother Nick ambaye ndiye amesimamia NHIF. So ukiwa hapa unaweza tembelea pale kituo cha Huduma Center, unaweza mpata pale, na pia unaweza pata huduma yapo ya kadi ama maswali yote unaweza jibu ya NHIF. Kwa sasa tukipenda bado kuendelea, na ningependa kumwalika mmoja wa wale ambao wametufadhili siku ya leo, ambao ni Kenya Institute of Special Education. Ni wale watu ama ni ile institution ambayo inasaidia watoto wale walemavu, na iko hapa tu karibu Kasarani, na tuko na mkubwa wao hapa ambaye ametumwa ama amekuja kuwakilisha, anaitwa brother kwapi? Ako hapa. Jo, karibu zungumze nasi, tuambie mnafanya nini pale katika Kenya Institute of Special Education. Karibu sana.
Thank you very much, MC. Distinguished guests, all of us who are celebrating this day, I want to say good morning to all of you. Let me take this opportunity. The MC has not introduced me. My name is Peter Disho. I work at Kenya Institute of Special Education. I'm representing our director, Dr. Norman Kiogora. I assist him in running the institute. And at KISE, we do very many things. One of the things that we do is we do assessment of children with special needs and disabilities. And why do we do that assessment is to ensure that we are able to guide and advise parents and teachers so that these children can get the right education, such that they are supported within the school programs, so to enable them achieve their fullest potential. And why are we associated with this day? Number one is that these children come from all our families. These are the same families where you have cancer victims, and therefore, in addition to a child having a disability, the same child is coming from a family which is also affected by cancer. Further to this, even these children with disability, some of them also are suffering from cancer, and therefore we feel greatly honored to be associated with this day. In addition to assessment, at KISE we also do we give a lot of therapy to children with disabilities. In fact, our physical and occupational therapy is classified as level 6. We have very good equipment for giving physiotherapy and occupational services to children. And even recently, we have started addressing adult clients. For children, when they come, they pay only 100 shillings. But for adults, it's between 500 and 1,000 shillings. For assessment, it is free. Free means that you walk in, you are assessed, and in KISE, it is the only institution in the country which the highest concentration of experts in special needs education. And therefore, I call upon Kenyans to bring children to KISE. Our society, we still have people who hide children with special needs and disabilities. We are encouraging everybody, bring these children. They have a right. If we read the UN Declaration of Human Rights, of 1948, Article 26 says clearly, education is a right to everyone. If we read our Children's Act and our Basic Education Act, education is a right to everyone. Whether the child has disability or not, let's take those children to the school. Those with the disabilities and special needs, please bring them to KISE. We shall advise, and that child will be able to learn. Further to that, we also do, we train teachers and other personnel to support persons with disabilities in all aspects of life. If it's children, we train teachers to teach them. We also train other personnel to support those children and other persons with disability. We also do a lot of research in special needs. And I want to mention here that as a third world country, the country has been depending on statistics that are from the World Health Organization, that between 10 and 15% in third world countries, you find that population is a population of children of people with disability. In 2018, we were able to do a national research, and we were able to establish in Kenya, we can proudly say, among our population, 11.4% are comprised of people with a disability. In a nutshell, we are saying we are a government institution which is established specifically to address matters of special needs and disability. We have our stud. You can visit us. You will get a physiotherapy there. You will also get other experts, and they can give you more. With that, I want to thank you as we continue celebrating this day. Thank you very much. May God bless you.
Thank you very much. Tupigie mkubwa wetu kutoka pale Kise. Asante sana. Kwa sasa tunaendelea tu bado na ratiba yetu. Wale tulikuwa tunafanya registration number 200 mpaka 240, tuendelee pale kwa registration 200 to 240. Na kwa sasa mgeni wetu wako karibu kufika. Ningependa kumwalika representative kutoka Huduma Center, sababu wako hapa ndio wametushikilia vizuri, aje hapa aweze kutunenea mawili, atuambie wanafanya nini pale. So karibu sana Madam Katun.
Habari zenu? Kwa majina naitwa Kalthum Kadhi kutoka idara ya Huduma Kenya. Nimefurahi sana kuja kwa hili kikao ambacho kimekuwa organized na National Cancer Institute of Kenya. At Huduma Kenya program tunapeana huduma za serikali kadha wa kadha. Kama leo ukienda kwa ile hema yetu utaweza kupata huduma kama NHIF, SSF, ID. Kama umepoteza kitambulisho chako unaweza kwenda pale ukapata kitambulisho kingine. Na tuna support the health sector kama kwa services kama za NHIF. If you're a mother or a child, you can go and apply for your NHIF, because pia kuna zile saratani zina affect watoto na wamama na kila mtu pia. Kwa hivyo hivyo ndio Huduma Kenya program ina support even the health sector, and we offer many other services. We have 52 centers across the country, so in case you need any government service, you can visit one of these 52 centers in the country. We have one center in every county, na katika county ya Nairobi kuna centers 5 kwa sababu ya population. Na ukiweza unaweza kuvisit any of these huduma centers. Kwa hii function ya leo tunapeana huduma ambayo tunaita huduma mashinani. So once in a while huduma centers wanachukua services zao, wanatoka kwa center wanaenda mashinani ndio waweze kupata wale watu hawawezi kufika kwa huduma center, ama pale huduma center iko mbali na watu hawezi kufika virahisi. Kwa hivyo leo mnaweza kuvisit ile hema yetu ya huduma kupata huduma ama hata kupata information about what you can do to get these services completely and end to end. Asanteni sana, shukran.
Tumpigie makofi vizuri sana wana huduma wetu ama Huduma Center. Asante sana kwa ile kazi mnafanya pale. Tukumbuke kwamba Huduma Center hakunaga malipo, ni kwenda hapo upata information yote ambayo ungependa kupata, either abstract kama umetupa kitambulisho yako, all information is found there. Tunapomalizia hii sehemu, ni vizuri to recognize some of the people ambao wako hapa ama service tunafanya hapa. Kishapata kadi yako pale, unafanya registration. After registration unatumwa katika kile chuba ambacho utaenda kupata services zile unataka. Tuseme kama ni cervical screening na breast kwa mama ziko. Pia tuko na kupima kwa sukari na pia kwa pressure bado ziko pale na inafanyika pale kwa ile tent iko pale imeandikwa Africa Cancer Foundation, na pia Aga Khan Hospital, kuna ingine Avenue Hospital, na pia tuna Texas Cancer Center. Hao wote wanafanya hiyo kazi ya kuweza kutupima ama kupima watu kulingana na ile ugonjwa ambao ungependa kuangaliliwa. Pia tuko na Janice Hospital, bado ni supporter wetu na wako pale wanatusupport vizuri. So kwa sasa tunapoendelea, ningependa kumwalika ama kualika badi yetu pia tupromoshie ama itupe wimbo moja abiri. Asante. Thank you very much. Badi yetu tumefanya vizuri sana mpaka kwa sasa, kazi inaendelea vizuri. Saa hizi tunaenda sehemu nyingine ya pili. Kabla tuingie sehemu ya pili tulifika mpaka 240 mpaka 290. Tunaweza songa pale for registration. Mgeni wetu amefika, na kwa sasa naomba nipumzike kidogo, nipatie mgeni wetu MC wangu ambaye anaitwa wageni ambaye asimame na endelee. Kwa sasa tusimame, mgeni wetu heshima amefika ili tuweze kumkaribisha. Asante sana.
Asante sana Boni. Our chief guest is now here with us, Madam Anastasia Nyalita. She is the CEC in charge of health, wellness and nutrition. Na nakaribishwa pale by some beautiful children. And as she comes, nitauliza that we give her a round of applause to welcome our chief guest. She's been introduced there to the team and taking a few photos. All right, so Madam Dr. Nyalita is coming to join us, and once she joins us, we're going to receive her. Today is our commemoration for the World Cancer Day. We have a few testimonials to share and remarks from our sponsors. Okay, so please take your seats. Please take your seats. Tafadhali tuketi. Madam Nyalita will go around looking at the booths, and then she will join us. So we can have the music.
Chosen generation, we've been called for to show His excellence. All I require for life, God has given me, and I know who I am. We are a chosen generation, we've been called for to show His excellence. All I require for life, God has given me. Working miracles.
part of entertainment. Coming to you live from the Kasarani Primary School grounds, where there is commemoration of the World Cancer Day on this 4th day of February 2023, with a national event taking place in Garissa County, attended by the CS Health, that is Susan Nyakimincha. We've had entertainment from different groups. Earlier on, we had different institutions talking to us on the effect of cancer and what is needed to eradicate cancer in the country, with many medics telling us that the biggest hindrance they have currently is the cost of treatment and lack of awareness amongst the masses and, of course, general public. And they have just been calling upon Kenyans to come out to get early detection, to get early screening, and if one is diagnosed with cancer, then there is that aspect of early treatment. We have got different institutions. We have got Kenyatta National Hospital. We have got Cancer Center, Texas Cancer Center. We have got different medical caregivers here attending this particular function. But the most important bit is that we also saw young girls within the age of 8 and 14 going to 15 getting their injection against HPV, and according to the medics, that is one of the most dangerous stages where young girls are also vaccinated against cervical cancer, and of course that is one of the biggest killers in the country, being number 2. On Thursday, during the inaugural function which was held at the Safari Park Hotel, the CEO of Ambref, that is Dr. Gidinji Gitahi, said that a number of people, that is 75 or 76 people, die daily because of cancer, and that is a big number. 75 or 76 daily, that is a big number, and therefore he is just calling upon stakeholders and the government at large to come out and eradicate the fight against cancer. Now, I'm not alone here. I'm with my colleague Gladys Mungai, who perhaps can take us through the Kiswahili session on what we should be expecting. Gladys, it's a very important day in the calendar of being the 4th day. Tutarejea yapi kutokana na mambo ambayo yanaendelea hapa katika uwanja huu wa Kasarani Primary?
Asante Victor, na kama ulivyowajulisha watazamaji wetu ni kwamba tuko moja kwa moja katika eneo la Kasarani hapa jijini Nairobi, na hii leo ni siku ya kimataifa ya siku ya kuadhimisha siku ya saratani duniani, ambapo washikadau mbalimbali, wananchi katika mataifa mbalimbali wanakongamana katika mataifa yao ili kushinikiza wananchi kujitokeza, hasa ikilinganishwa kwamba kunao unyanyapaa wa watu ambao pengine wamepatikana na ugonjwa wa saratani, na kilichoko ni kwamba kuna himizo mbalimbali kwa watu wasiogope jinsi ambavyo pengine majirani huenda wakawachukulia, bali wajitokeze na kupimwa, na iwapo watapatikana wana saratani basi inaweza kutibiwa ikiwa katika zile viwango vya chini. Unakumbuka kwamba kuna kiwango cha kwanza, cha pili, cha 3 na cha 4, ambapo katika ile stage ya 3 na 4 wanasema kwamba hali inakuwa ni ngumu kidogo, na kwa hivyo basi wananchi wanashurutishwa kujitokeza wakati ambapo saratani huenda ikagunduliwa ikiwa katika stage ya kwanza na ya pili. Na hivi sasa, mtazamaji, mgeni mkuu wa shughuli hii ameshawadia katika eneo la Kasarani. Shughuli hii inaendelea na punde si punde, kwa hivi sasa anazungushwa katika tenti ambazo zimekitwa kambi katika eneo la Kasarani na kujionea yale ambayo baadhi ya washikadau katika sekta ya afya wanatoa kwa wananchi. Kumbuka kwamba shughuli ya kuwapima wananchi pia inaendelea hapa Kasarani, na iwapo basi uko katika jiji la Nairobi, shughuli hii itakuwa inaendelea hadi mida ya saa 11 jioni. Kwa hivyo unaweza fika hapa na kuangaliwa na madaktari na kubainisha kwamba iwapo una ugonjwa huo. Na sio kwamba kupimwa ni lazima upatikane, mtazamaji. Kilichoko ni kwamba unaambiwa kwamba kuja na mapema, ndio iwapo utapatikana upate kupata matibabu na mapema. Na katika kambi hii na katika tenti ambazo zimetengenezwa katika uga wa Kasarani, na maanisha kwamba tuko katika eneo la Kasarani Primary, na hapa ndipo shughuli hii ya sikukuu ama siku ya kuadhimisha siku ya saratani duniani inaendelea. Usiende katika uga wa Kasarani, njoo katika shule ya msingi ya Kasarani, ambapo bali na kupimwa utakuwa unaambiwa pengine zile dalili za kuwa na ugonjwa wa saratani. Unaambiwa kwamba pengine ukijihisi hivi, ukahisi hivi, ama ukaona haya na yale ambayo yanaendelea katika mwili wako, basi usitupe muda, fika moja kwa moja katika vituo mbalimbali vya kupimia ugonjwa ama pia hizo dalili za saratani. Na mtazamaji, kukueleza tu kwamba kuhusiana na idadi ama saratani zinazoongoza hapa nchini, kuna saratani ya matiti ambayo ndio saratani inayoongoza nchini. Halafu inafuatwa na saratani ya uzazi. Hizi saratani ni saratani ambazo zinawaathiri sana kina mama, na saratani ya kuzungumza, hapa kwenye kuzungumza, unapozungumza mahali ambapo sauti inapotokea katika esophagus, wanasema kwa lugha ya Kimombo, pale unapozungumza sauti inapotokea katika kwenye shingo, hiyo ni sauti saratani nyingine inayoongoza, inaitwa saratani ya umio, yani saratani aina ya esophagus. Na hili ni kongamano ambalo linafikia kilele wakati ambapo washikadau katika sekta ya afya wamekuwa kikongamana hapa jijini Nairobi kuangalia tu hatua ambazo taifa limepiga kutokana na wakati ambapo saratani ilipogunduliwa nchini Kenya kwa mara ya kwanza, na ni vipi hasa taifa la Kenya na wananchi wanavyoweza kusonga mbele na kupunguza pengine idadi ya watu ambao wanapatikana na ugonjwa wa saratani. Na kuna saratani ambayo wanasema kwamba inaweza kudhibitiwa na pia ikaponeshwa, na kwa hivyo basi wanasema kwamba watu wafike na mapema, na pale ambapo visa hivi vitakapokuwa vinagunduliwa, basi kuna uwezekano wa kupunguza idadi ya watu wanaofariki kutokana na saratani. Na hivyo basi katika kongamano ambazo zimekuwa zikifanyika katika jijini Nairobi, wito umekuwa kwa Kenya kuungana na kuhakikisha kwamba ilichoko ni kwamba takwimu za sasa zinasema kwamba 70% ya wanaopatikana na saratani wanafariki, na wanasema chances of survival ama idadi ya watu wanaoepuka kifo kutokana na saratani ni 30%. Na kwa hivyo basi kilichoko kwa sasa ni kwamba kuna wito wa 70% hizo kubadilishwa, iwepo kwamba kuna 70% ya watu ambao wanapona na kuishi na ugonjwa wa saratani, kando na ilivyo kwa sasa ambapo 70% wanafariki. Na kulingana na alivyokueleza mwenzangu Victor Olo, ni kwamba afisa mkuu mtendaji wa shirika la Amref Daktari Githinji Gitahi amewatwika jukumu wananchi na madaktari na taifa kwa jumla pamoja na washikadau katika sekta mbalimbali, sio katika sekta za serikali, kuungana na kuhakikisha kwamba hizo takwimu zinabadilishwa. Na kulingana na hotuba yake alipokuwa akizungumza jana na siku kabla jana, anasema kwamba taifa litafikia masuala kama hayo kutokana na kwamba tunabadilisha tabia za nchi kutokana na masuala pengine ya matumizi ya chakula, matumizi ya maji, matumizi ya ujenzi wa miji hapa jijini Nairobi na katika mataifa mengine, katika miji mingine katika taifa nzima, ili kuhakikisha kwamba ni swala la kimsingi, swala la tabia, jinsi ambavyo wananchi wanavyoendelea na shughuli zao za kawaida. Kuna yale masuala mawili matatu unayofanya ambayo huenda yakachangia wewe kupata saratani ama yakakupinga zaidi. Kwa hivyo basi ni muhimu kwa wananchi kutazama na pia kufika katika mitaa mbalimbali wanapotakiwa kufika kufunzwa zaidi kuhusiana na swala la saratani. Jambo jingine mtazamaji ni kuhusiana pengine tugusie na idadi ya vituo vya saratani hapa nchini Kenya. Kulingana na ripoti ya shirika la National Cancer Institute of Kenya, hili ni shirika ambalo limetukwa jukumu la kupambana na swala la saratani. Idadi ya vituo vya saratani ni idadi ambayo kufikia sasa imefikia 67, na katika vituo hivyo, vituo 12 peke yake ndivyo vituo vinavyomilikiwa na serikali, na kwa hivyo basi ipo haja ya kuongeza idadi ya vituo hivyo. Na kando na hivyo, washikadau pia wanataka vituo hivyo pia vipatiwe vifaa vinavyofaa vya kutibu na pia kuweza kutambua kwa mapema, wanasema diagnosis kwa lugha ya Kimombo, saratani katambuliwa kwa mapema. Na kumbuka kwamba mtazamaji, ilivyoko ni kwa sasa ni kwamba pale ambapo mtu anapatikana ana saratani ya aina mbalimbali, huenda ikafikiwa wakati mwingine ukajipata kwamba unaarifiwa uende katika mataifa kama vile India, South Africa, pengine hata Dubai, ukatafute matibabu ya ugonjwa wa saratani. Na ilivyoko ni kwa sasa ni kwamba washikadau katika sekta ya afya wanataka Wizara ya Fedha na Wizara ya Fedha na pamoja na Wizara ya Afya waongeze ule mgao unaopelekwa katika Wizara ya Afya ili kudhibiti na kuongeza uwezo wa hospitali mbalimbali hapa nchini kudhibiti haya magonjwa ya saratani. Na ilivyoko kwa sasa ni kwamba walikuwa wanalialia kwamba ilivyoko kwa sasa 0.5 ya bajeti inayotolewa kwa Wizara ya Afya ndio peke yake imetengwa kushughulikia masuala ya saratani, na wanasema kwamba hizo ni fedha kidogo sana na wanataka ziongezwe ikilinganishwa kwamba idadi ya visa vya saratani vinazidi kuongezeka hapa nchini. Na kaunti pia zimeorodheshwa, kaunti ambazo pengine zimekuwa zikiripoti visa zaidi vya saratani humu nchini. Na ili pengine kukupatia hiyo taarifa mtazamaji, ni kwamba ripoti yake ya mwaka wa 21, mwaka 22, hii ni ripoti ya taasisi ya kitaifa ya saratani ya mwaka 2021 mwaka 2022. Kaunti mbalimbali zimeorodheshwa kulingana na jinsi ambavyo pengine visa vya saratani vimeorodheshwa katika vikaripotiwa katika kaunti hizo. Na kaunti ya Nairobi inaongoza, kaunti ya Nakuru ikifuata, kaunti ya Kiambu pia inafuatilia, kaunti ya Machakos pamoja na Nyeri zinafuata kwa karibu, Baringo, Kericho, Kakamega na Bungoma zinafuatilia. Hizo ni mojawapo ya kaunti kama 10 hivi zinazoongoza kwa visa vya saratani humu nchini. Na mtazamaji, nilivyokueleza, umesikia nimesema Nairobi, Kiambu, Nakuru, Machakos pamoja na Nyeri, na hizi ni mojawapo ya miji kubwa hapa katika taifa la Kenya, kuashiria kwamba ni sharti wananchi wanaoishi katika kaunti hizi wakajizatiti kuhakikisha kwamba kuna mabadiliko ya jinsi ambavyo pengine wanaishi, kutokana pengine na matumizi ya maji, matumizi ya chakula, na jinsi ambavyo pengine wasisusie kwenda kutibiwa ama kuangaliwa kana kwamba wana dalili ama pengine ugonjwa saratani huenda ukajichipuza katika mili yao. Pengine nimpatie mwenzangu Victor Olo akueleze mawili matatu. Hipo hapa katika shule ya msingi ya Kasarani, shughuli za kuwatumbuiza wananchi bado zinaendelea, na nafahamu kwamba waziri wa afya katika kaunti ya Nairobi ameshawadia na anazungushwa tu katika tenti mbalimbali ambazo ziko katika eneo hili kufahamishwa zaidi katika tenti hizo watu ambao wamekuja kuonesha ubunifu wao na vifaa ambavyo wanatumia vya kutibu saratani, pengine wanatibu nini na kwa nini pengine mwananchi aelekee katika vituo vyao na wala sio katika kituo kingine. Victor.
Very well. Gladys, apart from Kenya or the world at large marking the World Cancer Day, there's so much that is also happening here at the Kasarani Primary School grounds. We also have patients coming for their eye checkup. We also have patients coming for blood pressure. We also have others going for the COVID-19 vaccination also taking place in this particular venue. We also have Huduma number. If you have your NHF, you have your ID issues, there is a one-stop shop for you to get checked. We also have members from different places, issues to do with cervical cancer for that matter. Young girls are getting injections and so much more. So this is a one-stop shop for all that you may need. But coming back to this particular event, you know, first, cancer is one of the leading causes of death in Kenya, one of the top 4 causes of deaths. And accounting to almost 23% of patients do not seek for medical care, either due to systematic or attitudinal barriers, which include the high cost of treatment, long travel distance, or lack of equipment in different parts of the country. And in some instances, inadequate information regarding healthcare. You know, this is also based with what we had talked about earlier on with some of the service providers who said that a majority of Kenyans do not get proper attention on what is happening. All right, so we are still going back to the main venue where the event is still taking place. We'll be coming back to you later on with more information from the Kasarani Primary School grounds. This is KBC Channel 1.
Assistant County Commissioner for this division of Kasarani. I wish to take this opportunity to welcome you all to this ground with an assurance on Kasarani Sub-County. My boss is here. We are, by nature of security, we are very safe. Kasarani is very famous for many functions, including national functions, because we host a number of facilities, including Moi International Sports Stadium. So feel welcome, and I wish to take this opportunity also to invite the head teacher of this school, Kasarani Primary School, to come forward and also give us a welcome to his ground, so that our guests during this International Day of Cancer will feel at home. And in fact, this particular institution has been hosting medical related events, so we feel like sooner or later we shall have a medical center around here. Thank you very much. Bwana head teacher, karibu.
The chief guest, all protocols observed. My name is Charles Ateku, head teacher Kasarani Primary. My senior has already talked. He has already welcomed you to this facility, and all feel welcome. My duty is very simple, was just welcome you. If you feel like pressed, you are the chief guest just behind you there. The other people, their areas have been designated, but the young ones, you can feel free to use ours, and the other things, washing hands, are there. Otherwise, it has been 3 days of good event. Nothing abnormal has happened, and I just wish you to thank everybody for coming. Tell those ones who are still at home, the doctors, the nurses are still around for cancer and everything else. They come and make use of this facility that has been brought here. We are not taking it for granted for choosing Kasarani Primary among all the 250 public primary schools in Nairobi for hosting this event. Even if you have that one of Africa or that one of the world, still bring it to Kasarani. Thank you very much.
Thank you very much, Mr. Principal. I think tumpatie makofi tafadhali. You know, being a principal is not a very easy job. So thank you, sir. And thank you very much for hosting us here in your school grounds. Madam Chief Guest, allow me now to welcome, by way of extension, the MOH Sub-County, Dr. Peter Mugoi, to also make quick welcoming remarks. Thank you very much. And then we move on with our program. Dr. Mugoi, karibu sana.
The chief guest, our CECL, all protocols observed. My name is Dr. Mugoi Peter. I'm the Sub-County Medical Officer of Health for Kasarani. When I talk in Kasarani, in health, we combine Kasarani and Embakasi North by extension. Mine is just to update you that we have been here for the last 2 days. Today is the 3rd day. We have done a good job, and we appreciate all the partners who have supported this event. Maybe to give you a small brief, in Kasarani we have 10 public institutions, and I also need to mention that out of these 10 public institutions, we have 3 institutions, that is Kasarani Health Center, Njiru Hospital, and Dandora 2 Health Center. These 3 facilities are unique in the sense that in these 3 facilities we are able to treat cervical cancer, especially the minor lesions. So mine ni kuambia wananchi wote wale ambao wako na challenge, mkuje mfanyiwe screening kwa hizi facility 3 na muweze kutibiwa, especially zile lesions ambazo hazihitaji umaarufu mingi. They don't need speciality. Our chief guest, for the last 3 days, I think for the last 2 days, we have actually had 1,750 attendants here. And I have to tell you that out of these attendants, we have been able to screen 545 clients for both cervical cancer and breast cancer. And unfortunately, or fortunately, we have been able to identify 3 who had minor lesions, and all the 3 clients have been treated here and actually discharged home for follow-up. Also, we have screened 1,750 attendants for hypertension and diabetes, and we have identified 18 of them to have high blood pressure and high blood sugar, and we have referred them appropriately. Also, we have had COVID-19 vaccination here for the last 2 days. Probably today we'll compile the whole data, and we have vaccinated 135 clients for COVID-19, and we have vaccinated 174 girls aged 10 to 14 years for HPV. Kwa wale hamjui, HPV vaccine ni ile vaccine inapatiwa wale wasichana wako kati ya miaka 10 na miaka 14 kuzuia ugonjwa wa cervical cancer. Inapatiwa 2 doses 6 months apart. Na ningependa kuhakikishia kila facility Kasarani iko na hiyo vaccine. It is offered free of charge in both government and other institutions. Thank you so much. Mine is to welcome you. Feel at home for the rest of the day. Thank you so much.
Thank you very much, Dr. Mugoi, for those statistics. Indeed, there's a lot of traction that's been made, and we really, really, really appreciate. Madam Chief Guest, I want to just, by way of extension, appreciate and recognize all our partners who have made today very possible. Very quickly, we've got representatives here from Kenco, we've got representatives from Huduma Kenya, the hospitals as well who have partnered with us. We have Aga Khan here on site, we have Texas Cancer Center, we've got Radiant Hospital, Janice Hospital, Avenue Hospital, Kenya Blood Transfusion, KISE, the Africa Cancer Foundation, AHF Kenya, and the Clinton Health Access Initiative, otherwise known as CHAI. We also have our media partners. I am very ably informed that we are live, Madam, on KBC, and about to go live on CBC as well. This is a great day as we commemorate the World Cancer Day, and we have services for all our delegates, our visitors here today. I'm informed that there is screening of cancer, cervical cancer and breast cancer, both for men and women right here on site, and as well HIV and AIDS testing as well, all free of charge. Madam Chief Guest, cancer would not be a cancer story without the patients. And they're patients who have lived to tell the story. They have fought, and they are now here as survivors. They are now here as warriors. And just, you know, we want to hear their story. We have had a few testimonies, but we also want to hear 1 or 2 testimonials. And allow me to call very quickly if Jane Buto or Sally Agalo, you're here. Could you quickly just run? We want to hear your testimony in 30 seconds. Oh, Sally is here. She's a runner. Okay, great. Sally, very quickly. And you are Madam? Yo, Madam Jane, okay. But where's the man? Let me call a man for gender balance. Hold on. Daniel Jogona. Daniel Jogona, you here? All right. Very quickly, I'm giving you, come. I'm giving you each just a minute. Please share your testimonials so that we can quickly move on with the program.
My name is Sally. Mukiona kuna kitu nimevaa hapa, mnaiona? Kwa sababu kansa ilishika ile njia yangu ya kupitisha choo ambayo inaitwa rectal cancer, na kwa miaka 13 nimetembea na hii bag. Sijui kama mmewahi sikia group ambayo inaitwa Stoma World Kenya. Mimi ni member hapo, na apart from that pia nimesurvive cervical cancer. Kwa hivyo ninapenda kusema hivi, kama uko hapa na unaogopa kupimwa ati ukipata kansa utakufa, sisi tumeishi na unaweza ukaishi pia wewe. Mimi kansa nilipimwa mara ya kwanza 2007 na niko hai hadi leo. Kwa hivyo matibabu inafanya na tunaweza tukapona. Mimi sijaenda India, sijaenda South Africa, nimetibiwa hapa Kenya. Asanteni.
Mjamboni nyote, majina ni Jane Wanjiko. Na mimi hata hii bag mnaona nimebeba hapa, sio pesa nimebeba. Hapana. Hii iko kitu inaingianga hapo na imeingia for 3 years now. Na ninashukuru Mungu kwa sababu ameniweka uhai mpaka wa leo. Asanteni sana.
Protocol observed. All those who have congregated here because of this day, good afternoon. Good afternoon once again.
Check 1 2.
I'm a teacher by profession to start with. That's why I'm a bit official. But I want to thank God for the far He has brought me. My name is Daniel Njuguna, as you have heard. And I'm a survivor of cancer. I was affected by colon cancer back in the year 2016 when I was in the Great University of Nairobi. But I thank God that through the help of University of Nairobi and another institution, which I'm not so sure if it's around, Nairobi International School, the NIS, headed by Mrs. Lee, they really helped me. They gave me a hand when I left university, because when I left university in 2016, my cover was withdrawn. And so NIS came through. NIS has sent me through all the remaining sessions because I had only done 3 sessions. I did chemotherapy for 12 good sessions, and at some point my hair was all gone. But look at me now. Here I am. I really thank God for that. One thing before I leave the stage that I would only like to urge people who are here is that it's good to understand that all of us, at some point, we are candidates of cancer. And when one of your members is affected, please come close to them, talk to them, be there for them, because you never know about tomorrow. One of us was just here. He has testified that he's been with cancer for, 20 years. I can say that I'm proud right now. I'm 7 years all the way since I finished my treatment, and I want to believe that I'm going far. So people who are affected by cancer, either directly or indirectly, please, I would like you to know that that's not the end of the story. So many people, Sally was here also, she has talked about that, she was affected some years back, and she's alive. She didn't go to India, she didn't go anywhere. So it's good to note that we have the treatment with us here in Kenya. Let us visit those screening places to check our health, so that tomorrow you don't wake up and you are told that you have a cancer stage 3. For the parents who are around, please, cancer is not a death sentence. I'm saying this because of what I went through when I got cancer. And at some point, people would think I wouldn't make it. And I'm not ashamed to say that at some point, one of my family members thought that I wouldn't make it. But look at me. It's because of God. Blessings.
Thank you. Okay. Thank you. What? Okay. Thank you very much. I think our survivors deserve a better round of applause. Ile iko na nguvu. Tafadhali tuwapigie makofi mazuri. Thank you so much for even being bold enough to come and share your stories with us. We appreciate you and we honor you. We thank you and we say here is to more. Many more years. Another 15, 20 years we want to hear your story again and again. So thank you very much. Madam Chief Guest, allow me to just quickly request, in terms of representing all our partners, I want to welcome Lion Dr. Moyes Manji, apologies. He is the second Vice District Governor of the Lions Club, to quickly come and make a remark. Dr. Moyes, thank you so much for waiting. I understand you have another meeting to go to, but thank you. Very quickly, please share with us. Karibu sana.
Thank you very much. Chief Guest, all protocols observed. I represent the District Governor of Lions Club International District 411. My name is Dr. Manji. We have been part and parcel of this cancer journey. Lions Club International is an organization which is having 1.4 million members all over the world in 208 countries. All they do is they do have emphasis on childhood cancer as one of their global causes. We have a lot of programs in place where we do support with international support and have regular events, occasions, and services not only in Nairobi, but throughout the country. Lions Club International has got its own hospital, which is the Lions Eye First Sight Hospital. And we also have plans to make a cancer center within that hospital. As we talk now, we have a plan also to make a cancer recovery center scheduled to be put by the end of the year in Kisaju in Kajiado. All this thing has started off by having a fundraising activity which we are going to be rolling it out over a period of 2 years. With that kind of support that we are expecting from all our Kenyans, this thing will be a reality. Now this thing basically is that when you go to Kenyatta Hospital, which has got a beautiful third floor cancer center, it has a lack of accommodation and place where the child and the parent would have a place to recoup, because there's a shortage of the accommodation and all that. Seeing that in mind, we would like to have that center in place so that it's easier for people coming to Kenyatta, having a place where the recreation is taking place. With that, thank you, and we are all part of this event, and our journey has been for the last 105 years, and we will continue for many more years. Thank you.
Thank you so much, Dr. Moyes. We appreciate your partnership. Take our greetings with you as you travel. Madam Chief Guest, allow me to now welcome the County Health Management Team representative, Dr. Carol Ngunu, to make a few quick remarks, Dr. and also introduce your team.
Our chief guest today, our CEC, Dr. Anastasia Nyalita, our CEO, National Cancer Institute, our chief officers, all invited guests, our partners, good morning. We are quite excited to see the culmination of this day, where we have you celebrating with us the World Cancer Day. And Waziri, I must say that we've come a long way as a division of non-communicable diseases that was established in the year 2016 in the Nairobi City County government. We are the first county that developed a costed implementation plan for non-communicable diseases, and we have been able to implement and come a long way in terms of prevention of non-communicable diseases, screening and early diagnosis, as well as treatment. Waziri will be here until today, and our target was to reach at least 2,500 people. We are happy with the numbers that have turned out. We not only have the Kasarani teams, but we have our clinicians and our community teams from different sub-counties, because this was a county-wide initiative. At this juncture, allow me, chief guest, to introduce the CHMT members who are here present, who we've worked together as a team to make sure that the sector is well represented. So I'll ask them to kindly stand. Maybe you can just come here and introduce yourselves, just a few seconds. Kindly, the team, led by the head of the division, Dr. Kibe.
Thank you, Chief Guest. My name is Dr. Kibe Victor. I head the Division of Non-Communicable Diseases, and we are going to make Nairobi work. Thank you.
Good afternoon, ladies and gentlemen. My name is Roslyn Mkabana. I head the Gender-Based Violence Unit within the county. We are making Nairobi work.
Yeah, good afternoon, everyone. My name is Robert Rianga. I coordinate cancer and palliative care in the county. Thank you.
Good morning. My name is Caroline Magiri, Head of Nursing Services. Thank you. Okay, good afternoon, everyone. I'm Jessica Mbochi. I coordinate nutrition services in the county. Thank you.
Habarini za mchana wote. Naitwa Geoffrey Tumaini. Nasimamia tiba katika kaunti ya Nairobi. Asante.
Good afternoon. My name is Hannah Gadhura. I coordinate neonatal child health services.
Thank you very much. You may be seated. So at this juncture, I want to take the opportunity to invite our chief officers who will also give a quick remark. So I'll start with my chief officer, public health, Mr. Tom Nyakaba. Please, a round of applause as he comes.
Waziri wetu wa afya, nutrition and wellness, Nairobi County, Dr. Anastasia, my colleague chief officers, our county commissioners from the National Cancer Institute, wenzetu kutoka CHMT Nairobi, madaktari wetu wote wamefika hapa siku ya leo. Hamjambo? Hamjambo tena. I think before I give my remarks, allow me to welcome our honorable MCS present, wasalimie watu wao, so that as we move this area, tuendelee kwa utaratibu. Nataka kuwakaribisha kwa heshima kubwa our MCS, MCF for Kasarani, MCF for Mwiki. Tafadhali karibuni msalimia watu wetu as we proceed. Karibuni. Thank you. Nimeelekezwa kwa watakaribishwa. Sasa kutaka wasaulike pale. So I want to take this opportunity, and my name is Tom Nyakaba. I'm the Chief Officer for Public Health, to celebrate with all of us for this day. I know it is a great day, not only for all of us from the health sector, but as a country at large. Number two, as a department, a subsector in public health, our main aim is prevention. And that's where we are here today. We aim to prevent, kwa sababu tunajua tiba kuzuia ni bora kuliko nini? Kuliko kutibu. And that's where I'm encouraging all of us to leta watoto wetu, wamama wetu hapa wapate chanjo, waangaliwe, tuweze kuzuia ugonjwa wa saratani kwa haraka sana. Sababu najua ni siku kubwa ya our chief guest. Sitaki kuongea mengi. Thank you for welcoming us here, our partners, our heroes for the day, our survivors. Mungu awabariki sana. As a department, we are ready to work with you and even ensure Nairobi is cancer free in the next 10 years. Mungu awabariki na asanteni sana.
Thank you very much, our Chief. I also want to take this opportunity to invite our Chief Officer, Medical Services and Acting Chief Officer, Wellness and Nutrition and School Feeding, Dr. Irene, to also give us her remarks. Please, let's give her a round of applause.
Thank you, Daktari. Hamjambo nyote. Kwa jina naitwa Dr. Irene Muchoki, Chief Officer, Medical Services, na pia in acting capacity, Chief Officer of Nutrition, Wellness and School Feeding Program. Na sitaongea mengi kwa sababu mwenzangu hapa ameongea mambo ya shughuli ya leo ni kucelebrate cancer, World Cancer Day. Hii ugonjwa imetuletea shida nyingi na tumepoteza wenzetu. Wengine pia tuko na madada zetu wanaishi, wamekuwa they are survivors. I have two sisters who are survivors of breast cancer. So I know we can win this battle. Na tunasema prevention is better than cure, lakini ikifika wakati wa kutibu, hata matibabu tuko nayo. Yeah? So we have the services. So, and in short, tutasema tuko na diagnostic center. Tunataka kuanza at Udhiru Mudhua. Also, we are currently offering cervical cancer diagnostic and treatment at Mama Lucy, Mbagati, Pumwani as well. And then, we are treating precancerous lesions. Like behind there, we have the Beyond Zero van, where we are able to treat these lesions that don't need high specialized treatment. Again, tunafanya examination, breast examinations. Please, let's take this opportunity to go for screening, breast cancer, prostate, and all that. Also, we factored in to strengthen our imaging and other tests for early detection so that we're able to actually prevent our people from going through the long haul of having the full disease. So also we'll establish a registry ndio tunajua tuweze kujua ni watu wangapi wanapata hii ugonjwa na wale the ones who are survivors as well. So we are working to ensure that we have a healthy population free from cancer. Asanteni sana.
Asante sana, Chief Officer. I'll now hand back to MC to take us through the rest of the program.
Okay, thank you very much, Dr. Carol Gunu. We really appreciate you and your team. Madam Chief Guest, allow me now to take us to our next level of remarks. And for this, I want to welcome our Deputy County Commissioner, Mr. Joseph Minor, to take us through that particular section, where he'll also make a few remarks. Welcome the NCI Kenya CEO, and welcome you, Madam. Welcome, our DCC.
Thank you so much. Our very able MC, our chief guest, the County Executive Committee Member Health, Dr. Anastasia Nyarita, our CEO, NCI, Dr. Alfred, I forget the name, Dr. Alfred Karagu, yes. Our many partners who are with us this day, the various champions that we have seen here, the cancer champions and ambassadors, our national government administrative officers who are here in their numbers, our CHPs who have been very critical towards mobilizing the community, towards coming to this function, those who have entertained us, even those who have led us with our prayers, our elected leaders, before I forget you, and then it becomes a fight here and there. It's our pleasure having you around. Ladies and gentlemen, good afternoon. Afternoon again. First and foremost, it's our humble pleasure having all of you around this place. You have already been invited to this venue, and like it has been said, we have been very good hosts. We have been holding so many functions, both at the national government and at the county government level. And as you can see us, with those uniforms that we have been trying our level best to ensure that first and foremost, we are all secure. Remember, health is a security issue that besides the physical health, we also try our level best to see that we take care of the communities that we are serving. I want to introduce a team that I have here, which again has been very instrumental towards mobilizing the wananchi, not just this venue. You have been told that for the last 2 days that we have been here, we have hosted more than 2,000 people. And the team in uniform has been more than instrumental. I can also state without any fear of contradiction that during the ongoing summit, you must have seen some 2 chiefs who made some presentations and who were interviewed. One of them who happens to be here, Madam Christine Demba, and she gave an account of what we are doing as administrators to us ensuring that we reach out to everyone, to us ensuring that we fight the cancer disease. So I have some 2 ACCs with me. I have Madam Masika Foy. Madam Masika Foy is the Assistant County Commissioner for Roysabu. We have the host ACC, Bwana Tom Nyatete, who has already been here and made some remarks. I have a retinue of chiefs. Wako wapi? Chiefs and assistant chiefs, can see them in their good uniform. They have been very critical, like I've said, to us ensuring that we are here. So without much ado, I want to invite 1-2 people before inviting Dr. Karago to invite our chief guest. We have Madam Warima. Madam Warima, I don't know whether she's still here. I wanted Madam Warima to say, she's coming. Madam Warima has a word from the Member of Parliament, Captain Ronald Karauri, who has been so helpful to us.
Good afternoon, all our chief guests, all protocols observed. My name is Warima Mwangi. I'm actually at home, the head teacher. I was in Kasarani Primary. Now I'm an advocate of the High Court, and I work with Captain Karauri. I'm very, very humbled to have our constituency host this meeting. I was a part of it yesterday, actually. Your team has done an amazing job. I went from one booth to another, and I got everything done. I was screened for cancer. My blood pressure was checked, everything. They have done an amazing job. We're very thankful and we're very grateful. To the constituency, Captain is not able to be here today because tomorrow we're planning to host the president in one of our wards in Rai. He sends his greetings and feels very at home. To the members of Kasarani who are here, please note that there's a circular that has been going around that now we're going to be issuing DF bursaries. On the 7th, make sure that you go to the areas that have been allocated in the circulars, and make sure that you also bring the forms that you've filled back to the NCDF office in Jiru by the 15th. We thank you very much for coming. Take advantage of everything that is going on. There's also the launch of Huduma Mashinani. Take advantage of it. Take advantage of everything. Feel at home. And on behalf of Honorable Captain Karauri, karibuni sana. Thank you very much.
Thanks so much, Madam Warima. Want to take this chance to invite Mheshimiwa Kago, the MCA from Wiki, just to say a word or two, a word of encouragement to these good people that we have here.
Thank you. Happy Sabbath. When I say happy Sabbath, you say happy day. Happy Sabbath. Happy day.
Karibu sana our CEC and all the guests. I'm a Sabbatarian, that's why I've said today is a church day. But I said I should come here and celebrate this day because it's an important day. Also, I feel also at home and I feel nice because I used to play in these grounds. I'm an alumni of Kasarani Primary. This is where I did my primary school. Hapa, Pandiogeshagi. So, asanteni sana for this program. It's a good thing, this clinic. You know, cancer, we have been told, if it is detected early, someone has a chance of surviving. And I would like to challenge ourselves, and I will personally bring a motion in our assembly, that in all our hospitals, county hospitals, we should have these screening programs so that this cancer can be detected early. Suppose we have all these, I know this has been done this time, we should have more of those, more of this. We continue next week, we have another one every month. At least we have these things so that this cancer will be detected early and people will get healed. So from my point of view, from my side, from assembly, we shall support this initiative of making Nairobi, Kenya as a whole, as a cancer free. Asanteni sana na Mungu awabariki.
Thanks so much, Mheshimiwa Kago, for those very encouraging words. Karibu Bwana Maura Samora, the MCA Clay City.
Bwana asifiwe. Asifiwe tena. Asante sana DCC. Madam Waziri, karibu sana Kasarani. Majina yangu ni Maura Samora, MCA Clay City Ward ambaye ni jirani ya hapa Kasarani. Kwa hivyo Kasarani kuna MCA lakini hayuko hapa, but ametutuma tumwakilishe na ako sawa. Ya kwanza kabisa niseme, you know, cancer is one of the second largest killers in the world. If you check the current statistics, in 2020 and 2021, 10 million people in the world died because of various cancers. And among those cancers, the leading is breast cancer, which is affecting women. And that is why ningesema ni support my colleague there. When he brings a motion, Mheshimiwa, I'll support it 100%. We need to encourage our people to be tested. And that is why in my first term, I was elected first in 2017. And I used to have quarterly medical camps by Madam Waziri in my health center. And this is what I would like to encourage the department through your chief officers to work with MCAs who are willing to be doing these screenings, even if it's monthly or bi-monthly or quarterly in our health centers, so that people can come out and be tested. You know, in our community, in our society, we have this culture. People usually tend to come out for screening or testing when there's a medical camp. It is very hard for us to take ourselves to hospitals. Although it's important, our hospitals have these testing facilities. So I'll encourage you, Madam Waziri, to work with us and personally come to office to see how I can be doing it in my own, even if it's quarterly, so that people can be tested. And especially for men, you know, as men, we have a culture. We don't go to hospital until we feel pain. Doctors here will tell you, if you feel pain for cancer, that's late. Because that is, it means the cancer have advanced. So we need also to encourage men, especially in churches and other platforms, to be coming out for testing, so that at least we can detect this disease early and help fight it among our people. Just to request you, Madam Waziri, kitu personal for my ward. I have a health center that I started when I came to power in 2017. The Horizon Health Center in Clay City. And we've been having a challenge, like in many other health centers, of drugs. And the other day, the governor said, and I actually talked to him and confirmed to me, he had given some money to KEMSA. Please confirm to me that from Monday, my people will be getting drugs in the health center. Because it's a big challenge. My political opponents are taking advantage of some hospital Samora ametuletea hata ina aspirin. So tafadhali, naomba tafadhali, on behalf of all the health centers, please, let's have at least drugs available for our people. Thank you very much. Let's continue with this spirit of private-public partnerships so that at least we can help our people. God bless you.
Thanks so much, Mheshimiwa Mwaura. I think you have seen the type of leaders that we have in Kasarani. Very well informed, even on some very tough subjects. And we appreciate that we made those right choices. I want to, lakini kabla hata sijamkaribisha daktari, situwapigie makofi hao wote ambao wameongea jamani. Wapigieni makofi mazuri, makofi tena. So I want to take this opportunity to invite Dr. Karago Alfred, the CEO, National Cancer Institute, as we commemorate the World Cancer Day. Karibu Daktari. And you'll also take the honor of inviting the chief guest. Karibu sana.
Madam Chief Guest, waziri wetu wa Nairobi City County Government, and your team of chief officers and county health management team, our members of the board who I'll be introducing shortly, our partners, our service providers, na wananchi kwa jumla. Habari zenu. God is good and all the time. Very well. So, Madam Waziri, before I invite you to make your speech, allow me to recognize members of my board, because through their gracious support, we have been able to mobilize our partners. Tumeweza kuwa na the last 3 days of trying to create advocacy awareness about cancer. The last 2 days, we had a very successful summit at Safari Park. And now today, we want to finish it off by marking the World Cancer Day. So I want to recognize members of my board who are here. Please stand up so that I introduce you to the team. I see Madam Mildred, who represents NACOSTI in our board. Please wave. Thank you very much. And then I see at the back, Madam Agnes. Madam Agnes works in the media, so she has helped us in terms of publicity. Thank you very much. And finally, now allow me to invite Madam Catherine Washira to come and make some very few remarks on behalf of our chair. Thank you.
Thank you. Thank you, Dr. Karago. Our chief guest, the CEC Health, Dr. Anastasia Nyalita, our Deputy County Commissioner, Assistant County Commissioners present for Roysambu and Kasarani Division. I see our religious leaders have left, dignitaries present, Mabibi na mabwana. Good afternoon. All protocols observed, just in case I've left anyone out. I want to talk a bit about NCI Kenya. Leo nimesimama hapa kwa niaba ya mwenyekiti na wakurugenzi wa bodi wa NCI Kenya. NCI Kenya is a state corporation that was incorporated or that was created under the National Cancer Control and Prevention Act number 15 of 2012, and the purpose was a coordinated response with stakeholders, basically to look into the issue of the cancer pandemic. And as Dr. Karago has said, this is why we had a conference. We decided for the first time ever in Kenya, we held a conference last week, a summit, National Cancer Summit, the first, and we came up with certain resolutions. I will request my CEO to allow me to read the recommendations, because these recommendations are yours as Kenyans, and you need to hold us to account. Just hold it for me, please. Okay. Yeah. Will I be able to see? Let me show you. Oh, God. The first one is to strengthen multi-sectoral action in strategies and action plans on cancer prevention at county and national level. The second is to maintain the convening of all cancer stakeholders in the periodic national summits. The third is to build the capacity of healthcare workers, especially at primary healthcare facilities, to strengthen early detection of cancer, community health workers on how to package messages for community members about risk factors and disease prevention. Number 4 is to strengthen, expand, and sustain cancer screening programs to reduce missed opportunities for early detection. Number 5, is to promote policies that prioritize disease prevention, to support wider dissemination of appropriate information of cancer involving all organizations aligned to the Kenya Health Policy 2014 to 2030. Number 6 is to establish cancer-related advisory services at national and county levels to enable effective navigation of communities, including patients in the care continuum. Number 7 is to enhance research on cancer across the country to inform the design of targeted solutions. Last but not least is to remodel the health financing in Kenya to make it sustainable and equitable and support the commitment made by the national government on the planned restructuring of the National Health Insurance Fund, NHIF, to a National Social Health Insurance Fund, NSHIF, as expressed by our Cabinet Secretary for Health, Ms. Susan Nakumicha, at the summit. And we want you to hold us accountable as government. My fellow Kenyans, you have received advice this morning, mumesikia. Your health is in your hands. Tutachukua hatua tafadhalini sisi sote, tujue hali ya mwili zetu, hali ya afya yetu. Ukiona uvimbe ni tumor, yani uvimbe mali yoyote kwa mwili, hiyo sio kawaida. Mukisikia uchungu mali, hiyo si kawaida. Tafadhali take further action, see a doctor. Tunataka mkuje msimame hapa mseme, I went early, I was diagnosed early. Every year 42,000 cases are diagnosed. If you break it down, that is 115 per day. Please take action today. Thank you very much.
Thank you very much. Tumpigie makofi. Asante sana Madam Catherine kwa sababu ya hayo mawaidha. Chief guest, I just want to say one thing before I invite you, and really is to express our commitment to work very closely with all our stakeholders, particularly with our county governments, because tunaelewa kwamba afya iko katika ugatuzi. Health is a devolved function, and in terms of implementing our programs, lazima tushirikiane kwa karibu sana na serikali zetu za county. Kwa hivyo we are ready and open, and I think we have already signed some MOUs with your county government, so we'll be very keen to work with you towards scaling up services for the Nairobi City County. Kwa hayo machache, allow me now to kindly welcome you, Madam Waziri, to give us the keynote speech. Thank you.
Thank you.
Tumpigie makofi.
Yeah, to the County Commissioner, Nairobi, Chairperson and the board members of the National Cancer Institute of Kenya, representatives from the local county leadership, representatives from partner agencies, representatives from the private sector, civil society groups, cancer survivors, invited guests, members of the Fourth Estate, ladies and gentlemen, good afternoon. Allow me to make a few remarks to respond to some of the aspects that have been raised by our very good leaders, and also to make a few comments before I read the speech of the Deputy Governor, whom you had invited. He unfortunately was unable to make it, and he sent his regards and asked me to represent him. So receive greetings from His Excellency the Deputy Governor, and also just to respond to a couple of things. First, where is the headmaster or the principal of the school? Where is the principal of the school? Not around? Okay, fine. The reason I'm looking for him is because the last time I had an event like this, my father was a headmaster, so in the school that I went to. So this reminds me, my mother was also a teacher there. And this really reminds me of the days that, health was, you could get health anywhere, and also the kind of activities, at the public facilities and public schools that went. So these community events are very critical, and especially on matters of, community services. I also want to acknowledge our community health workers or volunteers. Are there any on the ground? Yeah. Good job you're doing on the ground. I only see you on the mtandao, lakini nitakuja kwa ground. Sawa. You're doing a good job. Thank you very much. And on the question of the drugs, it is true. KEMSA is fast tracking. They have the order. They're fast tracking. We should have them during the course of next week. We understand it's been a very tough situation for everybody on the ground within the county. We've not had drugs from KEMSA for the last 2 years, and we are doing whatever it takes to make sure that drugs are available in your facilities. The plan is we'll have His Excellency the Governor flag them off as soon as they're ready for dispatch to the facilities. And as you'll appreciate, KEMSA does last mile delivery. So you will be receiving in your county facility drugs from KEMSA. So we will update you as soon as the flag of date and time is confirmed. Currently we are looking at the 16th, but 16th is too far. KEMSA told us they'll be able to deliver the drugs by the end of next week. So rest assured that that will happen. But of course, as we do our work, we're also asking you for one big favor. You know, NHIF is the route to universal health care. We have in Nairobi currently around 103,000 indigents that are registered. We would like those ones signed up in our public facilities. So in your wards that you represent, tafadhali, we will do an NHIF registration drive. Please make sure that you have as many of your indigents in your area as possible registered in that facility. That's number one. The second thing, of course, is capitation. Since also we know NHIF is evolving, we have under UHC where, there's depending on the number of people who are signed up in your facility, you also get 250 every quarter. So that's about 1,000 bob a year for your facility. Again, that's important that you also help us with the drive to ensure that your residents register with your local health facility. On our part, we're very committed to ensure that health is transformed. If you remember, His Excellency the Governor did appoint a task force which did a stakeholder engagement to find out what are the reform, what's the state of health in the county and what needs to be done. I'm sure you remember that earlier in January, I think it was January 6th, we did hand over that report to the governor. It forms a blueprint of our of what we should do to transform health. And for us, as the governor also continues to inspire us, we're not competing with any other county. We're competing internationally. So it is to see the health of Nairobi counties, health services of Nairobi County, not only public sector, but private and faith-based, really go up to another level, so that even us, we can be able to seek health services wherever is nearest to us, whether it's public, private, or faith-based. So that's my plea to you. I will be calling upon, even as we launch, the flag of medicines, that's also our ask will be to the county assembly, so that at least in each of your facilities, we have a working healthcare. That's very important. And NHIF is going to be the vehicle. There's no other for sustainability. So that's agreed, right? But drugs next week, they will be there with you guys. We'll let you know as soon as it is confirmed. For the cancer survivors, thank you for sharing your stories. I know there are many more that will benefit or be touched by that because their voice may not be here to tell their story. For the affected and those who also are survivors, and those who are also living with cancer, that's a very helpful sharing that you've done. Thank you for sharing because it touches one or two other colleagues out there. So to the written speech. So it gives me a great pleasure today to join you. Sorry, the lights it's a bit. So yeah, it gives me great pleasure to join you today as we commemorate the World Cancer Day. This is a day that unites the world under the single theme to raise cancer awareness amongst the general public, while mobilizing all stakeholders to deliberate on the specific actions required to fight the disease. This year's theme marks the second year of campaign, Close the Care Gap, which is about understanding the inequities in cancer care and taking action to make the necessary progress to address them. Ladies and gentlemen, the rising burden of cancer being felt across our region and the world as a whole with significant socioeconomic implications in terms of healthcare needs, lost productivity, and premature death. The rise in the number of cases of cancer is due to aging populations arising from improved life expectancy and the increasing adoption of risky behavior, such as consumption of unhealthy diets, lack of physical exercise, harmful use of alcohol, and tobacco use. It is noteworthy that the health system capacity to detect and to diagnose cancer cases has been progressively growing, leading to higher proportions of the population being able to access cancer diagnostic services. And I must thank also the county team, and of course we have heard from the MOH of the sub-county, Dr. Mogoi, that we are able to detect and treat cancer within the sub-county. And it is my plea and prayer and commitment that this will be scaled up across the other facilities wherever it is not available. Ladies and gentlemen, our country is also facing the challenge of raising cancer burden, with estimates showing that we lose approximately 75 Kenyans every day from cancer-related deaths. The top 5 cancers include breast, cervical, esophageal, prostate, and colorectal cancers. These 5 cancers account for 48% of all cancer cases. There is therefore an urgent need to focus our efforts on prevention and control around them so as to stem the growing tide of cancer burden in our country. The Nairobi City County government is continually investing in the expansion of screening, diagnosis, and treatment services in line with our commitment to ensure access to the highest attainable cancer care services to the residents of the county, close to where they live. And we also continue to avail cervical cancer screening services in our public facilities from level 3 upwards, and you have heard the team speak to that, and we will continue to scale that up. Ladies and gentlemen, as we continue to invest in enhancing access to treatment, we're also keen in establishing programs on awareness creation that will reach all Kenyans. It is for this reason that we have integrated prevention and screening of cancer and other non-communicable diseases within the primary health care setting to ensure universal access to cancer care services. One of the main challenges facing us in this fight against cancer is the low uptake of screening and early detection services for the most of cancers. Less than 15% of the women in the reproductive age group have ever gone for cervical cancer screening, while only 10% of our women have ever gone through clinical breast examination from a healthcare provider. We must put greater effort towards screening and early detection to reverse this unfortunate situation. As a county government, we are committed to provide leadership in mobilizing communities towards screening and early detection. Ladies and gentlemen, I call upon us to intensify our advocacy efforts with a view of raising awareness among our people on the risk factors for the commonest cancers and the importance of cancer screening. The message that cancer screening and early detection saves lives needs to reach to all our households across this great nation, or great county. As I conclude, I wish to thank all the stakeholders who have been involved in planning for this World Cancer Commemoration Day, or World Cancer Day commemoration. I particularly applaud the National Cancer Institute of Kenya and its partners, Nairobi County Government, and the Kenya Network of Cancer Organizations for their tireless efforts towards the success of this activity. We are equally grateful to all the partners who have provided material and technical support. Working together, we will be able to halt the reverse and reverse the cancer burden in the country. Thank you, and may God bless you. Thank you very much, and I wish you that all the very best as you celebrate the rest of the day. Asanteni sana.
A very, very warm round of applause for our Madam Chief Guest, Dr. Anastasia, coming to us from the county. Thank you so much, Madam. Thank you for those words of remarks, and thank you for the commitment to really make Nairobi cancer-free in the next couple of years. Ladies and gentlemen, we now move to our next segment. We want to unveil the Goodwill Ambassadors for Cancer. Madam Chief Guest, we have pointed out and designated a number of people who are going to be our Goodwill Ambassadors, and I would like Dr. Karago to please come and take us through that.
Watu ambao wamefika hapa katika siku ya saratani kuadhimisha siku ya